just pulled up. He's full arrest.
Is he intubated?
No, not yet. Somebody grab the chest tray.
Welcome to Trauma Y and Crash. I'm Wyman.
And I'm Crash.
Today, we're talking about COVID vaccine. Where are you at on that vaccine there, Lonnie?
You should ask. I am one of the odd man out. I understand the necessity for the shot and why everybody's happy about the shot, but me myself, I'm not going to be the first in line for it.
Well, you can't be first because they already started giving them.
I'll wait a while.
So well, I'm gonna tell you, I'm gonna take my shot. When I have the opportunity to get it, I'm gonna take it. So let's talk about our different viewpoints.
Go right ahead.
What's your apprehension?
Usually when you're developing any type of vaccine, it usually takes 3 to 4 years or 2 years at the least. I think that this vaccine, good intentions, has been kind of rushed. I think that all the signs and symptoms haven't been studied appropriately because this is an emergency use. It's not something that's been tested. They need it now, and it's been approved for emergency use. So to be honest, to me, it seems as if the nurses are the long-term guinea pigs. And I don't mean the term guinea pig, but we are the long-term
anybody who gets it, you're the long-term study group, the
Right.
first wave. Absolutely. However, when they present it to Congress and they're not tweaking and stuff as they're talking about the need of it, now, here's my thought process. Number one, yes, it has been faster than ever. However, you have multiple companies devoting more teams than ever before. Where before, you had a department, and that's what y'all were working on. And there was a few of you. So it took a while because of what was going on. Now, it's important and it's now. So you have a bigger team and multiple drug companies all working together. Everybody's trying to get this. So if you looked at the time spent on developing the vaccines, I think they're relatively the same, or the COVID would be more, is my feeling. It is if you calculated all the hours spent by different people trying to figure this out. It's just that all at the same time. So that's one of the reasons why I'm comfortable. The other thing is, a lot, especially in the minority communities, especially blacks, I've heard a lot of my friends have said, I'm kind of hesitant because of like the Tuskegee experiment and stuff like that, which absolutely they trashed us.
They have
trashed, we were the guinea pigs. A lot of the minorities, all the minorities were used as guinea pigs. This ain't then. You look who's getting them. It's the first responders. So, if the first responders go, everybody dies. Because who's going to keep anybody alive?
Well, not to be derogatory or the bad guy in the room, look how the first responders were treated after 9/11. So we don't always give our first responders the best treatment, period. And
yes.
I understand that doesn't do with vaccines, but when you say, how they get it first, still, we don't hold our first responders and people in highest esteem.
Yes, and I understand that. However, that was more of an isolated incident, and, they had other people they could pull. And things didn't happen till down the road. But yes, they should have thought about the fact that a lot of this stuff was going to happen and not deny people, because that has been a history in our country. However, with it being the whole country, nurses and other healthcare workers getting vaccinations, they ain't going to have no choice. Because if we start to drop, who's going to be there?
Well, we don't start to drop today. We might drop 6 months from now. How many medications have
even if
done,
it's
though?
5 years from now, the country does not have the infrastructure to handle that. If even 15% of the people who get these vaccinations that are essential workers go down. There's no infrastructure for that.
No, it's not. But
so it'll have to be addressed. So I get what you're saying. And, you know, if there was a chance that they could squeeze it under the rug and just kind of blow it off, but this is too big. You're not going to be able to blow it off because it's going to affect everybody. Because if you screw up these vaccinations and you purposely put us at risk and you know something's going to happen, the person you kill could be you, because then when you have a heart attack, ain't nobody there to take care of you.
Let's take an example of drugs. How many drugs have been put on the market to come back and find years later that they had some type of side effect, causes cancer, or led to death of people? And I'm not just saying this will, but there are instances in the past of medications that do that.
Absolutely, but that's all the time. Mm-hmm. What drug do you know has been released with a long-term study? Do you know
longer than this one?
And what's long-term?
I would say long-term more than a year.
So a year.
Or
so you'd be comfortable if they don't die in a year?
Maybe I should say 2 years, because this is not a year. I said at least 2.5 years, 2.5 years, because you have a time where at least they've taken it for a year. And these studies, correct me if I'm wrong, out of the 30,000 people, half of those got the placebo. Is that correct?
Yeah, but now it's over that.
Okay, but only half of those patients received the extra medication.
Mm-hmm.
So you're looking at 30,000 people out of 300 million in the United States. So if I'm correct, that's less than 1% of the population that received the vaccine that you're using for emergency use. So I'm kind of looking at this as, well, you didn't test a large enough sample to tell me that this is 100% okay. Plus, those people with allergies, they didn't even test them, supposedly. And you got people having, which people do, but they didn't test them. That's what bothers me.
But here's the thing. You can't test for anaphylactic shock. You can't. And over in the UK, only two people had anaphylaxis, and the one was questionable. The one didn't even go to the unit. You know? Didn't get tubed. So, I mean, out of all the people they vaccinated, you got two. I mean, that happens with most drugs.
Well, just because I didn't get tubed don't mean it wasn't bad. If you put me on a BiPAP, that's still bad.
But for all the people, there's going to be some people that have reactions, and you can't tell. And here's the other thing to go with that. I'm not at the doctor's office. I'm not at a clinic. I'm getting it at the hospital.
Yeah, but what about those people that get it at Walgreens or CVS?
I'll go get it at a hospital. That would be one of the things I would try to tell people. But the other thing is, if you're getting it by medical people, you should be able to be saved.
Walgreens and CVS.
Nurse practitioners and pharmacists.
Have you seen some of our nurse practitioners?
They know how to give epi.
You can even do more than give epi. If it's an anaphylactic, maybe.
I'm going to give you epi.
What if you're not breathing?
Epi.
What if you're still not breathing?
You jumped up. You got epi. Epi cures all. Now, everybody out here who's listening to this, they're going, yup, I'll get epi.
Right.
You ain't moved, you're getting some more.
They not breathing.
You didn't move, I'm giving you some more.
CPR.
Yeah.
I'm not breathing.
So you do CPR. What's wrong with that?
But what if they don't know how to do CPR if they don't do it?
They gotta know how to do CPR. We're going to get you back. I mean, I'm going to get you back.
There's physicians that don't know how to do CPR. Have you been in CPR ACLS class where the physicians don't know how to do it?
We there.
See?
We there.
That's my point right there.
I don't think it's going to happen that often.
Okay.
I don't. I mean, because here's the thing. I think what you just told me is you need more people to take it before you. So you're okay with the other people doing it.
Unfortunately, isn't that what a test group is? Isn't that what a study does? It gives it to people prior to giving it to the rest of the...
So you just need more people to do it before you.
That sounds kind of bad the way you put that.
I'm sorry, y'all. Is that not what you just said? And is that what a lot of people are saying? I want to see what happens to when those other million people take it and they do okay, then I'll take it. So we can sacrifice. I'll sacrifice them. I ain't taking the chance with me.
That's not how I wanted it to come across.
What do you mean? That's what it sounds like. I mean, that's what I'm taking. How do y'all feel? I mean, I can understand studies, but when you look at the FDA and you look at what's a long-term study, nobody knows long-term. What drug do you know released in the last 15 years had a long-term study before it got released?
Yeah, but most of those people
And
take
if you
those
think
drugs.
about it, in our process, they have pulled more drugs in the last 15 years that they go, you know what? We were having too many reactions. So we're not going to give that anymore. Like Propulsit. I'll tell you, because I work on the floors and step down and stuff like that. We gave Propulsit to everybody. Next thing you know, it's getting pulled because people were coding because of it.
Yeah, that's true.
So, I mean...
But the question is, did they know this side effect when they started selling?
No. When you looked at it, they didn't know.
Okay.
They didn't know. But as they looked at more long-term studies, they started to see it. So, and that's the question. How long is long-term? What about for you all? What is long-term for you? When would you be satisfied with the test? And I know there's other people who are thinking about, are you worried about a microchip?
No, that's the stupidest thing you ever heard. Don't go put a microchip in nurses. Why would they want to follow us around? It'll be the most, well...
There's a lot of people... don't talk about Voltaire. But there's a lot of people... There is a lot of people out there who think you're getting chipped. And don't forget about the nanobites.
Oh, yeah, well... Nanos, you can be more likely than a chip. You ain't gonna put no chip that small.
But here's the other thing I would tell people, especially minorities who feel like, it's just gonna be the minorities who get that tested. And I understand things that happened in the past, but there's certain things that you just gotta watch for. Now, if you come in and you get ready to get tested, and they stop what they're doing, and they go over to this closet, and they pull out your dose, okay. But if they got a bunch of vials there, they're all marked the same. What? If you're concerned, you can ask them, can I see the vial? Sure. Can I see the next vial? Sure. They didn't, now if you pull a different vial, okay.
Okay. All right.
But I think that should take care of a lot of that.
And I'm not saying because African Americans are underrepresented and usually last to get anything that's worthwhile, especially like vaccines. So I'm not saying not to get your vaccine because if you want it and your opportunity,
and we're talking personal choice. We're only doing personal choice. We are not telling y'all what to do.
Same thing I said to my family.
We're doing personal choice,
yeah.
and the thought processes behind the choices that people are making.
Right.
But yes, and while I'm saying that, I am not saying we are not underrepresented, because we definitely are. From the time we're born and even before, there is a huge inequity in prenatal care and OB deaths.
Oh yeah.
There's a big discrepancy. There's a discrepancy in the care of even the NICU babies and what kind of care and staffing they get compared to other populations. Absolutely. I'm not saying that. But what I am saying is this would be something that I can't really see doing.
Oh.
Now, if your concern is, well, when you ship one over to the all-black neighborhood, it's going to be a different group. Okay, I could see you having that argument, but I think it's easily debunked. But I can also see why people have these concerns.
Yeah.
Because the disparity is there.
Yeah, it is your personal choice. As I tell my family, what I do is not, because all my kids are grown, and like I say, this is how I feel, but this is your life. You do what you feel is right for your life and what you want to do, because it's your choice. I would hate for you to not get the shot, then get COVID, and something drastic happens because you listen to me. No, look at the studies and look at what you think you want to do, and make your decision. This is my decision.
Yeah, because one of my brothers, he's not taking it, and I understand his reasoning. I told him why I'm taking it, and what I think about the science behind it. Now, do I know all the answers? Nope. Could we look up and all of a sudden they have issues with it? Yep.
And I could be wrong, and it's perfect. So
But the other thing is, I think I'd rather be alive to figure it out than die of COVID.
Well, we see.
And there's no good. You can't explain it. You can't explain it. one of my buddies. He is in great shape. He's a veteran. He's young. He's in the hospital with bilateral pneumonia from COVID.
Yeah. Yeah, it doesn't discriminate, and it'll take down the strongest among us.
And I saw somebody, they were 103. They had it, and they did fine. So, you know, there's some things that go to that, but even healthy people. You know, I saw one guy on the news, dude ran marathons in multiple countries, and he got it, and he died.
Yeah.
So, it's not, this is no joke.
No, I mean, you need to take it seriously and make your decision based on fact and what you want. And like I said, nobody can make that decision for you.
Please don't do it off of rumors. You know, when it comes to big decisions, ignorance is a killer. Google kills more people.
Well, I won't say that.
Yeah, Google kills more people because they look at that stuff. You know, working in the ER, I used to come in and they'd be like, well, I got boom, boom, boom. Who told you that? Google. Nausea, vomiting, and headache are symptoms in probably 1,000 different things.
Google, please don't email us or sue us. We're just stating our opinions.
True, but hey, Google, if you're looking for some people to help you, give us a call. I'll be glad. I'll be a spokesman for Google. We can make some changes and do things. But you know, the other thing is, it's not necessarily Google's fault because you can only get out what you ask.
That's true. That's true. That's true.
So, I'm not saying, because if not, if it wasn't that, then Google would be liable. And they're not liable.
No, they just answer your question.
Because if you put in, can I die from a headache? Google will say yes, because your headache could be an aneurysm. I mean, it could be so many different things.
Yeah,
so,
stroke, aneurysm,
yeah, it's not. So it's not. I'm not saying Google is bad. However, what I'm saying is people have to truly do some research. One story does not make it all that.
This is true.
So, you know, the other question is, so what are you all doing, especially the healthcare workers out there? You know, are you up for taking the vaccination? Do you have reservations? If you do have reservations, I would love to know what they are. Because here's my hope. I'm not trying to make a decision for anybody. If you don't want to take it, I'm fine with that, because I feel like it is your choice. However, what I don't want are people making that choice from ignorance. If you have truly good, logical reasons why, that's absolutely fine. But if you really don't know what you're talking about, or I heard this one person say such and such, do you really know that's true? Because in this world, you can look up, you have information. You can go to the New England Journal and look. They have a huge study on the vaccines that's right there, and everybody can read it. You know, do your research before you make your decisions. That's all. That's all I'm saying. You know,
I agree.
how you make what decision you make is your choice. Like my kids, they ask me, I give them all the facts. What questions do you have? This is a decision you need to make.
Yeah. Yeah, it's and people shouldn't take the shot as a one-all be-all to cure, because it's not.
No, don't throw off your mask and go rolling up. We partying now. Let's go.
It's not. And you know somebody's going to do that.
Oh, yeah. Because, you know, here's the other thing. Somebody doing that lying.
Yeah.
And they're not saying you won't get it. They say you could get it, but if you do, it's going to be a lot less intense. You know, and you wonder, there's a lot of big brother out there that goes with this. You know, do you have to have a card? Can you not get past this barrier if you don't have your card saying you've been inoculated? I understand all that, but the bottom line is it gonna work?
Yeah, that's the question.
Is it gonna work
without side effects?
Without any major side effects. There's always side effects. Nausea is a side effect.
Third eye is a side effect.
Third eye is in asterisks in the drug book when you look it up. Yeah. But yeah, we would love to hear what you all are doing and why. We'll do a follow. We're going to do a couple follow-ups on this one because this is going to be going on for a while. We're going to get different information, and some of the vaccines, they supposedly are the same, but then they're not.
No,
because the new one, you don't have to have the cold temperatures to keep it in that you did the other.
And the third one is a piece of the DNA of the COVID that you take. That one might be something I might be interested in because it's like the flu shot. You take a dead part of the flu, what is it? Of the flu, I guess, the strain, and you inject it and you build antibodies for it naturally. It's not with RNA. I think that's what they call it.
Yeah, but there's good and bad for both. However, it's not. What we don't want people to think is they're going to give it to you so that you can catch it.
No.
Because that's what a lot of people think. Well, you're going to give it to me, I'm going to catch it.
No. Supposedly not.
Yeah, so we'll see. We are just as interested as everybody else. And like I said, if you have information, please share it with us. If you have questions, please let us know. The other thing I would say is please don't forget to hit that like button and subscribe. Definitely pound on that, so that we continue to keep giving you the information that's out there and relevant to today. Do you have anything else?
Nope. Make your own decisions based on what you want and what you need.
Yes. But now here's the other question. Is it mandatory?
Since it's an emergency, from what I understand, since this is an emergency approval, it cannot be, they maybe can, but it can't be mandated because it's not approved yet. Once it's approved, that might make a difference.
Interesting, because I hadn't heard that. I heard it's going to be the flu's mandatory.
Yeah, but it's not a flu shot. Is not an emergency. It's a vaccine. It's not
right. But here's my question: they make it different every year,
and they get it wrong some of the years too, don't they?
What do you mean they get it wrong?
Like
they don't get it wrong. It's a prediction which one they think is going to be the worst.
Right.
Just because you catch the one that wasn't prominent. That's just your bad luck. That doesn't mean that they was wrong.
No, a couple of years ago, the strain that they picked and what they used was not effective. And their point was, well, it's better than not having anything at all.
Well, it wasn't that it wasn't effective. It was that most of the people who were getting the flu that year were getting a different strain.
They were wrong.
Huh?
They were wrong.
But it's all percentage. They think which one is going to have the highest percentage. It doesn't mean that strain's not out there. It just wasn't the predominant one.
Well, when I get a shot from the flu, I want the flu shot that's going to kill the flu that's there.
But here's the question, though, that really goes with that, and this is where the numbers really get into it, is if there wasn't that many people who had the flu that you thought was going to be prominent, so you made a vaccine for it, was it because everybody got the vaccine? Because you only counting the people who got sick.
Yeah, they still were wrong.
But you only count the people that got sick.
Mm-hmm. They told us, yeah, it's better to have some coverage than none.
Well, you know what?
Wrong.
If there's 5 different flus that I can catch, but there's a 30% chance on one and a 70% chance on the other. If I can't get the 70, do I want the 30?
Well, say that. Don't say this flu shot will be effective for this flu season.
But they do that all the time. I think this is gonna work.
I didn't hear that think.
How many times they tell you, I'm gonna give you this. This should help you. They don't say I think it's gonna work. They say this should help you, and then it don't work, and you come back and they go, you know what? We got something else. We'll try.
Mm-hmm. Yeah, but then they don't go, well, it's better than having nothing. We gave it to you. It didn't work, but it's better than nothing.
It fixed you partial of the way.
Maybe not.
Yeah.
Could have made me sick.
Might be a side effect.
Is death a side effect?
Yes.
Okay.
Yes, because if you listen to those commercials, if you slow them down, you will hear them say,
including death.
Yeah.
Hold on, back that up. What?
I mean, that's just like, there's always been a huge debate with lisinopril because of angioedema.
Yep.
But Afro-Americans especially do well with lisinopril, so why would I not want to take an ACE inhibitor if I can protect my kidneys? Especially when, if it happens, it doesn't happen to that big of a percentage. And even when it happens, the amount of people that die from it is really, really, really low.
Yeah, as long as they get to the hospital in time.
No, most of them, even when they get to swelling, they don't get tubed.
No, they very seldom do.
They look scary. It's a scary thing to look, and you can look down and you see your lip or your tongue. But I have to say, I thought I had it. I had some swelling, and at the time, I was on an ACE. I wasn't on lisinopril, but I was on an ACE. So I popped another one. I was like, let's see what's gonna happen. I was like, because I didn't want to come off of it and get off that kidney protection if I didn't have to. And actually, I knew a doctor. That was what she would tell people. She said, take another, go to the ER, sit in their lobby, see what happens. If you start to get short of breath or you start to have difficulties to get worse, check in. Because some of the other meds have worse side effects that you deal with every day.
True.
So they all, and I had somebody who called me because they were starting a medication. I'm not gonna name it, but they looked at all the worst side effects that they looked up, and I was like, you had to read the whole thing to find those bad side effects. Why did you go to the very end? And it's because those are the ones you worry about, but the numbers are really, 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 really low, to the point where was it just your time? Because if you're the only person that had that reaction from that, and I'm not saying all meds say, I'm not saying that. I am playing devil's advocate and just looking at it so that we can discuss.
Everything has a side effect. Nothing medicine you take does not have a side effect.
That's right. Even a Slurpee. Because you know what? A Slurpee can cause a lot of problems to a diabetic. What's going to be the side effect? Sugar going to go up. You could go into DKA.
You shouldn't take it in the first place.
True. Because of the side effect. It has bad side effect. Because the purpose of it isn't to raise your sugar. It's a side effect. What's the side effect if you eat too many Big Macs?
Fat.
Yeah, side effect. Not the purpose.
That's why you don't eat but one a day or one every couple of days.
True. But it's about knowledge, y'all. You really just want to go and look so that you can make a good decision. Or if you're making a bad decision, know why you're making a bad decision.
You can live with it.
Hopefully. But we will come back to you on these vaccinations as we watch the process and we get questions and comments from everybody. We will bring more to the table. But there is I like this guy. It's Dr. Bean. Do you know Dr. Bean?
I believe I've heard of him.
He's on YouTube. He has a lot of good information. So he just did a presentation on vaccinations that I didn't get to see on Friday. So I'm gonna watch that tonight. So we will update you. All right, everybody have a good one.
Be safe.